About 5 years ago, I came face to face with a health crisis, a public health crisis. I was living in Ho Chi Minh City in Vietnam, and every month my street would look something like this. During the high tide, the water would come up back through the stormwater drains and flood not only the street but into the first floor of our house. Now, in a city of 10 million people without any formal waste collection, you can imagine what that water might look like. Now, just for a moment, you're probably realising that I'm now referring to a public health crisis around infectious disease and may think that maybe I didn't get the brief for tonight, but bear with me just a moment. The reason I'm telling you this story, as an urban designer, this experience really got me thinking for the first time about health in cities. And I started to realise that if you look back into the early days of the evolution of Western cities, these issues were very prevalent. This is New York in the 1830s, just shortly after the cholera epidemic, where living conditions were such that infectious diseases were everywhere. Now, one of the major solutions to addressing that was through urban planning. This is Frederick Law Olmsted's plan for Central Park in New York. He's perhaps one of the first landscape architects. And while this park is often praised for its foresight, what we can actually see is the primary reason for this park was actually to address a public health issue. If you like, you could look at landscape architects and urban planners as the first public health advocates. But what happened? Because of industrialisation, as you'll be quite aware, cities have often been seen as unhealthy places. And because of this cultural identity that the city was bad, we started to create the suburbs, a place where you could have both the town life and the city life. But as populations have expanded, urban planners have gone from being the good guys to being a major contributor to affecting NCDs. As populations have grown, the suburbs have expanded and expanded and expanded. And due to the popularisation of the motor car, we've allowed development to occur in locations where there isn't access to public transport, where there isn't access to services. And while I'm showing here an example of Melbourne's outer fringe, we see this replicated across cities in the United States. And equally, as urban expansion grows in less developed nations, we are starting to equally see problems occurring around development that's not near transport and services in Vietnam, in China, and in India, and many other countries. Now, why is this an issue? Well, if we look, and we've seen in some of the videos tonight, even just now in Mongolia, now for the first time in human history, over half the world's population lives in cities. Between now and 2050, we're going to see the urban population grow by 1 million people per week. That's another Adelaide or another Copenhagen every single week. So are we simply going to allow our cities to grow and expand in the way that they have over the last 50 or 60 years? I hope not. And I want to talk about some ways that I think we can address the way that we're planning and design cities to improve health outcomes. But first, I just want to tell you a little about a girl that we worked with recently. Her name's Sarah. We were working to plan and design a school in an outer suburb area of Melbourne. Now, lack of infrastructure in some of these new communities is a really big issue, so having a primary school as a community centre was a really great initiative. But Sarah started to tell me about her life and her patterns of living. And I guess what struck me was that there were actually a lot of things that she really loved about her life. She loved going to school where she was currently at school. She liked her friends. She liked the parks. Her parents moved there because they liked the country feel and the open space. But they also had to commute an hour and a half each way to work. That's 3 hours a day. That meant for Sarah that she was in before school care and after school care every day. Now, Sarah couldn't walk to school because the road between her house and the school had no footpath and an 80-kilometre traffic speed limit. There was no safe way for her to go. And in many ways, this is a story about a very ordinary person in a very ordinary suburb. But someone like Sarah has a 1 in 3 chance of contracting diabetes, becoming obese, and has a far greater risk of facing social isolation. So when we look at some of the solutions that we can look about how to address situations like Sarah's, how to change the way that we're planning to design cities, I just want to touch quickly on 3 things. And these 3 things need to be looked at on 2 levels. One is the design of cities. The other is a sense of co-responsibility, because actually only less than 2% of the population are urban professionals, and if we are going to create the level of change that we need to see in cities to combat urban growth, we're going to need everyone to be a partner in creating urban change. The first is walking and walkability. Now we know that people are really only prepared to walk about 400 metres or 10 minutes before they'll get in a car. So we need to create safe places to work. We need to create housing that's near services and education and other things. But a lot of places don't have necessarily safe places to walk. So on one solution, yes, we need better design. But there are a lot of initiatives around the world that are just showing you can get out there and do it. Maybe you don't have a bike lane. Well, this group here just went out and painted one weekend. Equally, and I love this is a pop-up zebra crossing that you can roll up and carry with you, take wherever you like. And these projects, while they are small, what they do is they demonstrate that you can actually change a pattern of use. And sometimes that is actually more effective than waiting 3 to 5 years for council to get around to putting in that pedestrian crossing. The other thing is public space. There's a really interesting study that's come out recently by Beyond Blue, Depression Association in Australia, called Beyond Blue to Green, which draws a notable association between green space and mental health. We heard just before in the video from Mongolia about how access to public space can be a major barrier to people facing opportunities for exercise. So in public space, again, yes, we actually need to create opportunities, but we can also do things ourselves. This is our organisation last Friday in South Bank, where we turned one of the streets into a park for a day. It cost us $500 and a roll of AstroTurf, and what this did was start to have a conversation with all the local residents, the local stakeholders. There's obviously all the arts institutions and the university in that location, about what this space could be. It currently is used for about 50 car parks, but not much else, and whether there's a way that this could become a public space. This concept, this is called a parklet, has gone viral all over different cities in the States, and we're starting to see some local councils putting in parklets in places in Melbourne as well. And finally, safety. If you don't have a safe community, it's very difficult for you to get out and about and exercise or feel that you can actually own your open space. This final example was a project that we did in partnership with a group called Elos Institute in Rotterdam. It's a social housing development, and this open space in the middle had been hugely problematic for the community in terms of safety. As we were developing a long-term strategy for this park, one thing that we did was we got the residents together, and in 2 weeks we built this temporary park. And what that did is, instead of working towards a long-term master plan, which we were also doing, we actually showed that with existing resources we could create something right now. And one of the spin-off effects of having this park is we had people who had been living in this building for 18 years, but they didn't know some of their neighbours, and they were coming to get to know them through this active project. So these are quite small examples, but I think if we start to scale these, we can see the opportunities for creating urban change. I'm encouraged by what Jamie Lerner said. He was the former mayor of Curitiba, who was instrumental in changing their public transport system, that any urban change is possible within 3 years. Any urban change is possible within 3 years. So I say that if not us, then who? And if not now, then when? Thank you.